Okay, everyone. Next speaker coming up is Dr. Raymond So. Dr. Raymond is currently the Director of Elite Training Science and Technology of Hong Kong Sport Institute, the Elite Training Center in Hong Kong. He has been actively involved in sports training and sports medicine research for many years. His major responsibility at Hong Kong SI is to drive innovation and scientific, medical, and technological support to coaches to systematically and positively impact athletes' high performance results. He has done extensive research on windsurfing in the areas of muscle activation patterns, physiological demand, and training methods. In recent years, he emphasized on performance enhancement of elite cyclists. His research areas include muscle fatigue pattern in different cycling techniques, energy utilization during different types of cycling competition, and recovery modalities. His research work is published in international academic and professional journals and numerous keynote and invitational presentations. Dr. Raymond has served the Hong Kong Association of Sports Medicine and Sports Science for 20 years and was the president from 2001 to 2005. He is currently a commissioned member of the association. Besides, he serves as a member of the Athletes Performance Enhancement Subcommittee of Hong Kong Paralympic Committee and Sports Association for Physical Disabled, a member of the Medical Sports Science Committee of the Asian Paralympic Committee, a member of the Committee on Physical Education of the Curriculum Development Council, a member of Education Commission of the International Federation of Sports Medicine, an executive member of Asian Federation of Sports Medicine, a member of the Board of Directors of Association of Sports Performance Center, and Secretary of Preparatory Executive Committee of the Associations of Sports Institute in Asia. He is also a member of the Journal of Exercise Science and Fitness Editorial Board. Looks like Dr. Raymond is really a busy man and with high credential. And let's look forward to listening and learning from him. All right, Dr. Raymond, hand over to you.
Thank you, Danny. Thank you for your very kind introduction. So that I just realized that so many of the titles. Thank you. So I enjoy this symposium and I enjoy Rico's presentation. So that I really thank the Singapore Sport Institute and the NYSI to invite me here to speak with you some of the operation that we have done or some of the experience we have gained in the past few months regarding the how we handle the COVID-19 situation in Hong Kong. But I found a problem here is my presentation is reversed. How to share my presentation now?
Dr. Raymond, there's a share screen button at the bottom. Yeah, green color. Yeah.
Yeah. Okay. So I'm trying to do something to introduce some of the work that we have done in the past few months on how HKSI Hong Kong Sport Institute to maintain the environment for Hong Kong athletes to still maintain the training as much as possible. In order to achieve that, there are several principles that we are working on. First, we are trying as much as we can to maintain the training for our athletes. Because as the management or for the operation people, the most easy thing for us is to close down the facility. If the facility is closed down and then that the work left to us will be minimal. But we believe that this is very important to maintain our athletes training so that we are working very hard to achieve this principle one. In order to maintain the training, the second principle that we are working on is to maintain a safe environment as much as possible. Because we cannot just let our athletes to be trained in a uncontrolled situation, so that we have to do every effort, every of the measures and control to make sure they train here and will not be risk them or exposing to the COVID-19. And third principle is all the operation, all the measures, all the controls has to be rational. Because in some of the area, some centers, as I know, they just close down everything, not allowing the people to go out, not allowing the people to come in and then stay for many, many of the months. So that to us is quite difficult for our athletes to work in such a situation. So that all the measure we do is to try to be rational. And some of you may know that or remember that in 2003 in Hong Kong, we have the experience of the SARS. Okay, you can say it's very unlucky, but I would say that it's lucky that we exposed to such situation in 2003. But although this is very unpleasant experience because many lives have been lost during at that moment of time. But because of that, we realized the importance of how we handle the virus problem, the pandemic or epidemic situation. So in 2004, I have brought up a paper to summarize all the experience we have learned in the work that we have done in 2003. So that the three major things that we are aware that in order to make sure the training is maintained, that our athletes or all the people in the training center has to minimize or avoiding the unnecessary contact as much as possible. Secondly is the personal hygiene. So that is the reason why Hong Kong athletes or Hong Kong people are not difficult to wear masks to keep social distance at the current time, because we have the experience before. And also that although that we do try to keep all these things, but maintaining a good immunity is also very important for us to getting less of the sickness problem. Because if in such situation we got sick, that will be a very difficult for us to handle, because maybe mixing with the COVID-19 symptoms, so that is a very serious situation we have to handle. And also after the SARS, we developed the guidelines for us to work against the different levels of the outbreak of the virus disease. So that we have developed the HKSI pandemic and against the virus agent alert and action plan, something like that. Because along the years from 2003 to the current time, there were several of the episodes of the virus attack to Hong Kong, for example, the swine influenza, so that we activate the work of these guidelines. So to maintain our athletes to be trained in a safe environment. Regarding the guidelines, we also work along with the Hong Kong government, so that to align with the precaution measures also, so that the measure talking about how to control the people coming back to Hong Kong, how to control the access to HKSI, how to do the infectious control supply, because that during the pandemic situation, getting the mask, getting the protective gear is very important, and also to maintain the environment hygiene. And also one thing we also established from that moment is a review panel or expert panel. So that in this expert panel, we have a group of doctors, professionals to help us to revise the situation, to review the situation, and also to adjust the measure and the control that we are working on. Regarding the preventive measures, so that we are, as I said, we work along with the Hong Kong government guidelines, so that there are several of the levels that we have developed in our HKSI guidelines. There are five levels for our operation, but there are only four levels in Hong Kong government. The difference is the final one, the urgent response. The urgent response level means that if there are a positive case found in the campus of HKSI, and then we will up to the urgent response level. And unfortunately, during the time of the COVID-19, we had to up to that level. In each of such level, and then we list out clearly about the prevention details. For example, how to clean up the floor, the frequency of cleaning the facilities, all these in details. And also that in our appendixes of this guideline, we also listed out how to do the cleaning. For example, 1 to 99 or 1 to 49, the cleansing agent, all these are listed in the appendix. And for the prevention, there is a approach that we are using is ABC. First is the air and zone control. B is the breaking the chain. And C is the human carriers. All of you agree that in order to make the venue be safe, cleaning is the most important thing. So that we have to first maintaining the cleanness of the air, so that we have to make sure that the air quality in the indoor area are good. So that is talking about the air exchange times, and also if possible, and then we are open the window to get the air from the outside to dilute the indoor air quality. And also, we also advise all the times that our athletes and our coaches have to wear the mask before and after the training. And also that if you are not under training, you should have the mask on in order to protect you and the others. And also we operate the regular disinfection of the hostels, the resident area, offices, and the training facilities in a regular basis. The frequency depends on the level of the alertness. And if, unfortunately, if there is any of the positive cases happening in HKSI campus, and we will do the thorough disinfection of all the indoor venues and facilities for the whole campus. For breaking the chains, you know that all the disinfection agents usually last not long, mostly are instant, so that the cleaning procedure will clean up the space, but it will not last for even hours. But after the SARS in Hong Kong, some companies in Hong Kong especially, they develop some of the technology or some chemicals that can stay on the surfaces as a coating, and that coating will have the disinfection ability and can be last for maximally 90 days, 3 months. So that during the time that we get to the third wave of the COVID-19 situation, we have started to use this method, so that we invite the company to come and then to coat most of the area that our athletes and our staff we exposed to, including the hostel, fitness training center, even the kitchen, so that to give a better protection to our athletes. And finally is the human carriers, so that you know that the carriers of all the virus usually are the human being. In order to control the environment, the access control is very important, so that we exercise different level of the access control in order to minimize the mixing of the people. So first, we are controlling the people to get to our sports medicine center, our fitness training center, so that because in the sports medicine center and the fitness training center, the people at that area will be usually crowded, and also they will sometimes cannot wear the mask, so that we have to control the access to these areas. And also that the second thing, we are trying to minimizing the mixing of the athletes, staff, or different kind of people, because this is a measure trying to minimize the exposure to the risk, so that if the less people you are mixing with, then the less chance you will be less of the risk of getting the COVID-19 problem. And also, in order to make sure all the people come to HKSI are clean, we gradually increase the coverage of the COVID-19 tests according to the situation. So that I will discuss this or introduce this later in my presentation. So getting back to the development of how we handle the COVID-19 situation. So back to 2019, end of 2019. At that time, the such situation happening in mainland China. So at that moment, we started the serious response level. So that is talking about 3 areas: personal hygiene, symptom analysis, and infection control supply. So that from that time, we recommend our athletes and staff to wear the mask, and also have to have our staff and athletes to report of any symptoms and stay home for till recovery before coming back. And also we started to source and to buy more masks and other protective gear in order to protect our athletes. So that is the end of 2019 and early of the 2019 situation. Then on 22nd of January, because of the first case of the COVID-19 problem in Hong Kong, so the level of the response raised to emergency level. So that regarding the 3 areas that we are talking about: prevention, minimizing, and align with the government policy. So we first control the access to the SMC services and also the fitness training centers, and also minimizing the gathering, allowing less of the people to coming into HKSI. From that moment, and then we started to suspend all the junior and non-OG Olympic and Paralympic part-time athletes to come to HKSI for the training. So that means that at that moment of time, we only maintain the full-time athletes to be trained inside HKSI. And also because of the government policy, all the most of the sports facility in the community is closed. So that the Hong Kong government also started to work at home policy. So that from that time, we also activate the work at home policy for the non-frontline staff. So you can see from this timeline. So on 28th of January, HKSI started to stop all the junior and part-time training. And on 30th of January, we started to have our non-frontline staff to work at home. Till March, the situation worldwide is getting worse. So that originally we sent out, in January, we sent out the athletes to overseas because it seems that the COVID-19 problem is expanding in Hong Kong, so that we send out the athletes to overseas. That is the experience we got from SARS. During the time of the SARS, that because of the Hong Kong and mainland China situation, so that we sent out all our main athletes to abroad for the training. And at that moment of time, because of the problem didn't spread to other area of the world, so that our athletes can stay there for 1 year, some of them. But this time is different. This time, the COVID-19 problem spread around the world, so that in March, early March, because of the worldwide problem, we recommend our athletes to come to Hong Kong. And unfortunately, that some of the athletes, there are 3 of them, back to Hong Kong, and because of one athlete got symptoms. At that time, there was no mandatory testing, so that because of one of our coming back athletes got the symptoms and went to the doctors and finally got the positive test result for the COVID-19. And 2 of the athletes coming back with him at that time were also tested positive. So that totally we have 3 positive cases happening in our campus. So that's why that we have to activate to the highest level of the measures during that time in March. And what we did, when we find the cases in HKSI, we first started the mandatory testing for all the athletes and staff coming back from the overseas in order to make sure they are clean. And also to trace the contact, the close contact of those, because 3 of the athletes back to HKSI and stay in HKSI and trained in HKSI. So that along their training, there were some contact we have to identify. And then those being identified have to be tested also. So that is one of the how we do the tracing. So we gone through all the CCTV in HKSI and then follow the movement of the positive case athletes, and then to locate who are within the 3-meter distance, so that whoever in this link will be tested to make sure that they are clean and they are not being affected by the COVID-19 problem. It took us a very long time for doing this because these 3 athletes be in HKSI for about 3 days, so that we have to do a very thorough checking of all the video. And also that because of the government policy also strengthened, and then at that time all the community fitness center has to be closed. So that means that we also need to close our fitness center. But in order to maintain the training of our athletes, we move the equipment outside. So that we move the equipment to the outdoor environment and then allowing our athletes to maintain the training. So during the time in March and April, this is the second wave in a sense, that we test, as I said, we test all the athletes coming back. And we started to do the closed camp operation. Closed camp operation means that the athletes, whoever wants to stay in HKSI to maintain the training, they are free will for doing that. So that they volunteer to stay in HKSI to do the training, but they cannot leave HKSI. If they left HKSI, they could not come back at that time. So that we are trying to maintain a closed environment. A group of athletes, a group of coaches, and a group of support staff were stayed in HKSI hostels and the hotels for totally 6 weeks in order to maintain the training, but in a safe environment. And as the situation is getting better, we are allowing the athletes, whoever was not in the camp originally, to join the camp through testing. And also, we are allowing some of the staff, if they have to leave HKSI and then have to change the support staff to come to HKSI. So we use the testing method in order to make sure whoever come into the closed camp situation are clean. So that totally we did 351 tests in this whole period of time. And unluckily, 2 positive cases were found. And these 2 are our coaches who also came from the overseas. Actually, these 2 cases were have the relationship with the previous 3 athletes were tested positive. So that through this testing, we also identify positive cases. And this is the timeline for summarize what I have just mentioned. So that HKSI operates the closed camp situation in 25th, and also later on we close our fitness center and move to the outside. During the closed camp situation, as Rico said, it's also very important to maintain or to support those who are not in HKSI. So that at that time we did something similar to SSI did, so that we send out the video, how to do the training, how to maintain your nutrition situation, and provide them psychology support in terms of the booklets or even the online consultation. So that all these are trying to maintain those who are not trained in HKSI to still maintain a proper training. And also, we believe that for those who were in the closed camp, in order to make them feel that they are not alone, and also wants them to contribute to the community, so that we develop some protocol or program for them to reach out to the public for encouraging the community to do some exercise, to encourage them to stay home more, and doing some motivation speech to the community or the athletes in order to maintain the positive morale or attitude to face the COVID-19 problem. So in order to reopen the camp in May, because of the situation is getting better, and then that we discussed with our consultants, and also the government relaxed their control so that we resume normal training in May, and first start with the part-time athletes and then for the other athletes. But when whoever they come back to HKSI, they have to do the health declaration and also to strictly uphold the symptom analysis procedure, so that in case of any symptoms, they have to report to the situation. And also we constantly review the situation along the situation, so that these are the timeline, so that in May 8th, we open the camp, and in May, then we open the venue for the part-time athletes. In July, because of the situation we call third wave, the outbreak came to Hong Kong again. And suddenly that the government announced that all the school has to come to early commencement of the school holidays, so that HKSI get back to the closed camp situation in order to protect our athletes. This time, total time is 7 weeks. But this time we maintained the outdoor fitness training center, but we still open the fitness training center. Because in July, as you know, it's quite hot outside. So that in order to maintain the training for the athletes, we maintain the operation of the fitness training center. But this time we only allow 30 athletes per section inside the FTC. And also because of the situation is worse than in March, so although in a closed camp situation, we also need to do more testing to protect our athletes. The first batch of the test, we have all our frontline staff who were not in closed camp, like the security people, like the catering staff, so that we have them to be tested on weekly basis. So the first batch was done on August 5th. And unluckily, one positive case were identified. So that's because of this case, and then we have to clean the whole institute again. And also we have to have all the personnel stay in the closed camp be tested. So that within that we did a lot of the testing to make sure the athletes are clear. And because of the safety measure, we did twice on a weekly basis, so that just because of the incubation time, so that we did twice of the test to make sure our athletes are safe. And also in order to allow the athletes to join the camp, we also using the testing procedure to do that. Okay, these are the timeline is talking about what I just mentioned. And also in September 11th, that the situation is getting better. And at that moment, Hong Kong government started the universal community testing. And then we make use of this community test so that to open the HKSI camp, because we have to have all our staff, everybody in HKSI to be tested. And then as Hong Kong is all be tested, so that we are trying to make use of this opportunity to open the camp and then allowing athletes to have a better life of training. And why I say to resume normal training, but I use the quote for the without the need of mask wearing, because in HKSI, our athletes training, we not allow or not recommending our athletes to wear the mask during training. But in the community, the Hong Kong government will have to have our people to wear the mask during training, so that in order to maintain the without mask training in HKSI, we did something more than the community, so that we have the weekly test in HKSI. So this weekly test is talking about to have all the staff, all the athletes, all the coaches. It's talking about 1,000 people to receive the test for weekly base. And then up until today, we have gone through about 4 times. So that is a summary of how many people will stay in the closed camp during the situation. You can see that there were about 132 people staying in the closed camp during March and April. And in July, in the start, there are only 200. But at the close of the situation, more and more athletes want to come back to have the training, because been long time they didn't have the training experience opportunity. So that because of the situation of the outside is getting better, and then we make use of the testing procedure, allowing the athletes to come back to train. So that all in all, there are several things that we learned and hope to share with you. So that in order to face this situation, we have to have a good preparation. And more important is the accurate information, and also to have the measure to be implemented. And the preparation, and as I said, because of Hong Kong has gone through the SARS, so that we have the experience, we have the guidelines, so that we are better prepared. We are in good preparation for facing such situation. And also because of the several of the episode of other problem, and also reactivated our measures, so that I would say that Hong Kong SI is well prepared for such kind of the attack. And also that we all the time, whatever the situation change, we develop some kind of the guidelines in response to the need. For example, during, as I said, in March, we have to develop the guideline how to locate the close contacts, because the Hong Kong government, their definition of the contact, the close contact is different from what we are operating in HKSI, because we have the gym, we have the training facilities, and they are unmasked during the training, so that we make use of other procedures. And also during the closed camp, how to operate, because during the closed camp operation, very difficult to handle how to allow the athletes to come back. If the athletes have the medical need, if they go out, can they come back? All this has to be considered and well written in the guideline. And also the information, because you may hear a lot of the rumor or hear and say about the COVID-19, how that transmitted, how important, so that all these information are running around. So that in order to make our guidelines, our operation be scientific and evidence-based, so that we need to have a very accurate information. So that we develop 2 medical expert groups. One is internal, one is external. So that whenever we need to change or adjust our protocol, we have to seek the advice from these 2 groups in order to make sure what we did are evidence-based enough. And also have to communicate with the Hong Kong government in order to make sure our operation and our procedure are aligned with the government policy. And as I said, have to keep update of the world research funding and practices, including the transmission pathways and the technology, because we use some new technology in order to face the challenge of the COVID-19. And also that we have to control the hygiene. We have to implement the hygiene access control, testing and closed camp, and have to develop different operation guidelines. All these are very important to make sure that our athletes are well protected in HKSI. Luckily that although there were 3 positive cases in our athletes and 2 positive cases in our coaches, 1 positive case in our cleaning staff, but there were no second transmission in HKSI situation environment. So that is a good thing, so that we believe that our operation can protect our athletes to be trained in So thank you for your attention and my presentation stop here. Thank you.
Dr. Raymond, thank you for your presentation. That was very insightful information, and we get to know how well prepared and Hong Kong is, and how well you have learned from the history of the history of SARS pandemic.
Yeah,
that was pretty amazing. I really like it that athletes were able to be housed in to continue training. Yeah, I think it would be great if we can actually plan for this in future. But definitely, I hope we will never have to face this pandemic again in this lifetime.
of course.
Yeah. Let's see. All right, Dr. Raymond, I have a question for you.
Yes,
in terms of the government policy on the lockdown and how exercise training can take place, was there consultation with Hong Kong SI before all this decision were made?
You mean the Hong Kong government to HKSI?
Yeah, Hong Kong government actually have consultation with Hong Kong SI in terms of how training can continue with athletes and stuff like that?
Actually, no, because that the Hong Kong government taking care of the whole community, so that whatever they announce, they in place is facing the whole community. But when during the time when they in place such policy to the community, there are some policy affecting our training. So that, and in order to maintain our athletes to be trained in HKSI, we have to discuss with the Hong Kong government to give us some kind of exemption, allowing our athletes to be trained. As I said, for example, the mask requirement. The Hong Kong government in July, in their policy, that they did not allow the athlete, all the people to go out without mask, even when you were in training. But our athletes cannot train with the mask because it's dangerous to us because of the training intensity and volume. So that we have to discuss with the Hong Kong government to give the exemption. This is from the Hong Kong government exemption. So that allowing our athletes, because they were tested, because they are under a closed game situation, so that when they were training, they need not to wear the mask. But after the training, before the training, they have to wear the mask. So such kind of the operation, we have to discuss with the Hong Kong government in order to get the exemption. Otherwise, that our athletes will offend the law of Hong Kong. So that if they were caught, and then we will be in a very difficult situation. So that in order to maintain the training, the continuous communication with the Hong Kong government is required. And also, as I said, the testing procedure in July, start from July, is getting more and more. That is also the recommendation from the Hong Kong government. So that they believe that through the test, we can make sure that the group, this cohort in HKSI are clean, so that we still maintain the test operation from as today, because Hong Kong situation is getting better now. The community is getting more and less back to normal, but we still maintain the testing procedure just to make sure we are in a good protection situation.
Okay, thank you. We have a few more questions. Probably take one or two more, and then I'll leave you to answer them in the chat. So one question was there a big increase in the running, in the cost of running for Hong Kong SI during these last 8 months?
Yes and no. Okay, why I said yes and no, because yes, because of the testing. Hong Kong, the testing is quite expensive. So that we spend quite a good lump sum of money for doing the test. And also for cleaning and all the measures, we have to get more people to do the cleaning, but unfortunately, one of the cleaners were found positive. So such kind of the operation cost increased significantly. But on the other hand, because our athletes and our programs cannot go outside, So every year we spend we have quite a very big budget to support our athletes to go abroad for training and competition. So that because they could not go out, so that save a lot of the budget for HKSI. So that is why I said yes and no, because on one hand we save a lot, on the other hand we spend a lot. But by comparison, that the budget-wise in HKSI this year is we have quite a good reserve in this time.
All right. Next question. What are the Hong Kong policies to control tournaments running in Hong Kong during the pandemic period?
I will say that up until now, we still don't have any tournament happening in Hong Kong. So that most of the originally planned international events were cancelled. There are some competition happening in Hong Kong, but all are local based. So that up until now, we are not allowed, the Hong Kong government still don't allow the international competition being carried out in Hong Kong because the 14 days quarantine requirement is still on. Whoever come to HKSI, come to Hong Kong, have to go through the 14 days of the quarantine. So that if that is still in place, and then that is very difficult for any of the association to host the international competition. But on the other hand, we are started to allow our athletes to go out for the competition, because in the last month, in September and August, at that moment we still didn't allow any of our athletes to go abroad for training and competition because of the safety concern. But nowadays, because some of the country or area in the world are quite safe in a sense. For example, Singapore is quite safe. China and Australia are okay. So that, and also that some international competition are organized in a very safe operation. So that they build the bubble, they build very good quarantine procedure, but is talking about 2 or 3 days, and testing procedure, and also all the people involved in the competition are quarantined, tested, and isolated. So having considered all this, we started to allow Hong Kong athletes to go abroad for competition and training. For example, now our table tennis team are in mainland China for the competition, and our sailing team, we are now planning to Australia for the training camp, so that we are HKSI is start to allow the athletes to go out now.
All right, great. Dr. Raymond, thanks a lot for your insightful presentation. There are a few more questions that are asked, so please help us to answer them on the chat. And we thank you for your time, and we look forward to your discussion later on.
Thank you.
Yeah, thank you.
Thank you. Bye.
Okay, everyone, let's take a few minutes break. In the meantime, you can also help us to provide some feedbacks to Rico and Dr. Raymond. Just scan the QR code on the screen. Thank you.